said, welcome to our first ever Deliberation Unpacked. And I just want to kind of start with why are we doing this? So what is the programme? What we're coming together for? So at Involve, we've been thinking a lot about impact in the last year or two and the impact of our work in participation and deliberation. And we're working to kind of look more deeply at kind of the reasons why or the factors that make a deliberative process impactful. So what we're doing is we're bringing people together who've been involved in some of our processes over the years, and we want to explore the routes to impact through our work. So looking at way processes have influenced or changed decisions, changed mindsets, and increased capacities or priorities. And so we think this learning is really valuable to other people as well. This is why we're having these open sessions that we want to be accessible and free for everyone to join. So we think this will be valuable for people interested in commissioning deliberative processes so that they can better understand the potential impact that these processes have, as well as kind of some success factors, some tips and tricks as well. We think they'll be valuable for other practitioners in delivering impactful processes, also learning from things that maybe haven't worked so well as have worked well. It's valuable for us at Involve because we want to be able to better track and understand the impact of our work. And we recognise impact just doesn't necessarily happen the day after a process finishes. Sometimes it's not until months or years down the line that you actually see the impact. And I think that's something that will come out in today's session. And we also think it's valuable for members of the public to see what the real value of participation and deliberation is. So we're really, really happy to welcome you here. And we're looking forward to kind of seeing what insights this series brings. This is our first ever session, so we're really open to hearing feedback from you as well about how we could make this better for everybody as well. It's very much one of these that we're open to kind of changing it as we go along. So thank you very much for all introducing yourselves in the chat. Really appreciate it. For anyone who's just joined, if you can just say in the chat who you are and what motivated you to attend this session. And I'm going to introduce a bit about what we're talking about today. So we're kicking off this series by digging into a really powerful project that achieved some really impressive impacts, MH2K. So this is a project that we worked with Leaders Unlocked, between Involve and Leaders Unlocked. It was a real partnership. And it's a project that engages young people in conversations about mental health in their local area based on kind of a participatory action research approach. And it's worth saying that it is still run now. So Involved were involved in the early days, but this is something that has continued until now. So Sarah and Bella, give us a wave. We're involved in the early stages of this project in the Oldham pilot, and Bhavan was a participant early on and now runs the programme as well. So it's really exciting. That's impact in itself. So the project empowers 14 to 25-year-olds to identify mental health issues that they see as most important, engage their peers in discussing and exploring these topics, and working with key local decision makers to make recommendations for change. So as I said, we're really delighted to be joined by Sarah, Bhavan, and Bella, who all had a hand in the project in different ways. And I'm going to invite each of them to introduce themselves because you'll do a much better job than me. So Bhavan, do you want to give us a line or two about who you are?
Everyone, my name is Favan. I was part of the pilot project in 2019 in Derbyshire, and since then I work for Leaders Unlocked now as a project assistant. I'm in my third year of university, and I just started college when I first joined MHGK, so it's been a very long time since then, but honestly it's been such an exciting journey. I can't wait to tell you guys all about it. But I'm going to pass on to someone else now. Sarah Allen, could you go next?
Yeah, sure. So hi, everybody. My name's Sarah. I am currently a freelance specialist in what I would call public engagement in decision making. So ways of engaging people in order to help shape decisions that you're going to take as an organisation. As part of that, I do freelance work for Involve as one of their senior associates. But at the point this project started, I was a permanent member of the Involve team, and my early role in the project was to co-found it, co-develop it, and co-run it for its first 2 years with Leaders Unlocked. Bella, that leaves you.
Brilliant. Thanks, Sarah. Thanks, Bhavan. So my name's Bella Starling. I'm director of an organisation called Vocal. Vocal brings people and health research together for everyone's benefit. So we work very much in the kind of space of co-production, public involvement in health research. At the time that MH2K started, we were called Public Programs, and now we're called Vocal. And I was mainly involved in the Oldham pilot of MH2K, and then joined the advisory group for the national initiative as it rolled out after the Oldham pilot.
Brilliant. Thank you so much for the intros. So for the next half an hour or so, I'm going to pose some questions to Bhavan, Bella and Sarah. We're going to answer them and respond. And then we'll have the last 20 minutes or so for your own questions. So if you've got any questions that are brewing, take a note of them, and then I'll go and have a look in the chat for further questions, if that sounds good. So I'm going to start off by asking a bit about the background to MH2K. So what was the setting? How did this come to be? I'm going to kick off with you, Sarah, if that's okay.
Yeah, so I'll start, hand over to Bella, and then Bella can maybe hand back to me. So the kind of background to it was that we were looking to develop work with local government or local public services, and we were looking to develop that work on an issue that lots of local areas were struggling with, where traditional decision making wasn't helping to resolve, or wasn't fully resolving the issue. The local government issue lots of areas were struggling with, and we were also looking to develop an engagement model that was replicable, so that local government could look at one area and how they'd run the engagement, and then kind of see that it could be used in their area as well, but to build within that model enough flexibility so that it could adapt to the different contexts and different populations in different areas. So I had a few ideas about that. I knew Rose and Leaders Unlocked from a previous job, and I went to see them to ask if they would partner to suggest a couple of topics, and we quickly hit on youth mental health and emotional well-being. Bella, I'll hand over to you, and then perhaps we can come back.
Great, thanks, Sarah. So at the time, back in 2016, 2017, I was and still am working in kind of public engagement and patient involvement in health research. And I just at that time started a fellowship that was looking at how can you become more equitable and more inclusive in the ways in which we do that engagement and co-production. And at the time, I wasn't limited then to kind of focusing on health research. And I really wanted to, I suppose, kind of challenge some of the ways in which kind of engagement was being done at the time, and kind of move beyond some of the kind of traditional practices and traditional hierarchies, I guess. And it was through that fellowship that I was able to, have the opportunity to develop relationships and projects. And that's how I met Sarah. And Sarah described what she was trying to do with Rose and Leaders Unlocked. And at the time, I also had some very strong connections within Oldham, and in particular, with a director of public health in Oldham, who was very also keen to explore, kind of participatory engagement. And it was really through those connections that I became involved, and that then the project grew, I guess. Back to you, Sarah.
So Bella introduced us to Alan Higgins, who was the Director of Public Health in Oldham at the time. And at the time, the situation in Oldham was that they decided that youth mental health and emotional well-being was a priority for them, and that they wanted to develop a strategy around it. But they hadn't decided at all what was going to be in that strategy. So that is where we started. We keep referring to Rose. Rose is the Leaders Unlocked Director, just in case you were wondering.
Brilliant. Thank you for that intro, Bella and Sarah. So with all of that in mind, what was the challenge that you were trying to look at through this project?
So we were trying to look at how engaging young people in a way that in a youth-led project could help to improve youth mental health and emotional well-being in a local area.
And I guess my challenge was around kind of engagement methodologies as well, and kind of thinking about, kind of how do we do more inclusive and more equitable engagement that is potentially, and we obviously didn't know any impact before we set out to do it, but has the potential to influence both, I guess, social change and, in my world, kind of scientific change as well. So those were my kind of motivations and challenges.
Brilliant, thank you. So I'd be keen to hear kind of what was the reaction that you had? Like, what was the process? Who was involved? Bhavan, should we start with you as a participant in that kind of early days? What was it that you did, or what happened?
So I guess I should start off with how I actually joined the project. So I received an email from NCS one very, very, very late evening that I did not expect to see and had no interest in looking at. And then I applied that same evening. I remember thinking this kind of looks, but then I did it anyway. And then the day after, I think I had an interview with Anna. I don't know if you guys have heard of her, but she's really lovely. She was the project assistant at the time, and she was supporting Rose. And then from there, I did my interview, and then they happily took me on. But I did have a lot of barriers in myself personally because I came from a very, very strict background. So when I first got accepted, my parents did not want me to attend at all, and they were under the impression that I wasn't going to attend. Sorry. And now that I work in the field, I understand how silly it was what I did. But I did often go out of my way to pretend I was going somewhere else just so I could go to the MHTK meetings. So that was one thing. But one day I remember they did find out where I was, and they came, and I was very scared and very upset. But Anna and Rose handled it so well. Like, they spoke to my parents and they clarified everything, because I remember I was telling my parents, like, I really want to come back, please. Like, I don't want to not come here again. And their attitudes towards mental health was very, very traditional, very, very derogatory. But I think after I started to show interest in it, they were more scared that I was kind of entering a field that's very Western. But regardless of that, I still attended the meetings anyway. Like, that was my way of rebelling, to be honest. Not by doing anything bad, but going to do some stuff that I actually wanted to do and enjoy. And I remember that's how I first started on MHGK. And then just the consistency from the staff and making sure that I wanted to take part, I was happy, and they're checking in, following up after, making sure I was safe. Like, all these things really motivated me to keep coming to the sessions, even though I was also very anxious talking about mental health and well-being. That's one of the things for me.
Brilliant, thank you. And thanks for sharing kind of that background as well and the context, Bhavan. So can you tell us a little bit more about those meetings or the process? Kind of what did you do as a participant in those early days?
Yeah, no worries. So we had our kind of targets in each session, but the first meeting we came and then we all introduced ourselves to each other. There was tons of us, loads of us in one room. And then we'd split off into groups and talk to each other, which was really nice. We'd have, at first we talk about what we cared a lot about in regards to mental health and well-being, and then we collect these themes. And then I remember the meetings after, they'd always take, well, obviously I know this because I've worked in after, but they'd take notes. And I remember I was so surprised. I was like, wow, they listened to my suggestion. It's on the sheet in front of me. And from there, we'd kind of draw out further ideas. And then with that, we shaped our peer research, which was even more exciting for me because I was so surprised that they'd taken it and they'd managed to turn it into an agenda that we could use. And when they mentioned that we were going to like schools and colleges and stuff, I was so excited because it just felt so, how do I say, it felt like you were hands-on involved in actually creating an impact, and it didn't feel like it was just kind of talking to a wall or something. I think that's one of the things I noticed with everyone. There was a great sense of like hopefulness and excitement because it felt like people were actually listening to us and we weren't kind of being pushed under the rug, or we weren't being, how do I say, tokenized for a youth incentive. It was actually, we were actually being cared about and paid attention to, which is one thing that we really, really loved, and really what kept us going and staying on the project even after 2019, despite COVID happening after.
Brilliant, thank you so much. Sarah, from like the other side of the table, can you share anything from your perspective?
So from my side of the table, MHGK is basically a 6-stage process. So it starts with recruiting a group of 20 to 30 citizen researchers to lead the project. And that recruitment is done very intentionally. So it involves reaching out to young people who might be most at risk of poor mental health and emotional well-being. So reaching out through young carers, organisations, for example, youth offending teams, young LGBTQIA plus groups, and so on and so forth. We do also reach out, and did also reach out through, for example, through schools and other groups, but we made sure that we were saying that what we were looking for in those cases was young people who perhaps weren't getting as much out of formal education as others, and would benefit from the opportunity to develop their skills kind of through a different means, and as well as for young people who had direct experience of youth mental health, poor mental health and emotional well-being, either themselves or through family. friends. So that was how I can say more about how recruitment worked in the Q&A if you want to ask me about it. But there was recruitment. We then worked with the young people who identify themselves the top 5 or 6 themes that they want to focus on in their particular area. So mental health and emotional being really broad. So they develop the top 5 or 6 themes, and then we work with them in those initial events that Bhavin was describing to develop designs for workshops that they can then go out and run on those themes with their peers. That's stage 2. Stage 3 is what we called the roadshow, where they took out those events and ran them for at least 500 of their peers in those areas. So going back to the same sorts of organisations that we recruited through, as well as to schools and so on, as Bhavin was saying. Then we kind of took all the information that came out of the roadshow and took them to what we called the results day with citizen researchers, where they went through all that information and determined for themselves what they felt were the most important findings about the problems about mental health and emotional wellbeing on each of those themes, and their top 10 ideas for recommendations. And then finally, that's 5 themes, because the 6th stage, I realise, is a local advisory group. Sorry, Carly. But the final kind of involvement with citizen researchers in the initial phase of the project, at least, was the big showcase where they presented their recommendations and talked about their experience and sat down and discussed all of that with local decision makers and researchers who could help take the recommendations forward. And yeah, the local advisory group was really important because it brought together kind of key local players from the council, from the clinical commissioning group, from local mental health charities who could help take things forward. And if they were involved all the way through and kind of interacting back and forwards with the citizen researchers, at least that's how we did it for the first 2 years of the project. I should also say in Oldham, actually, the project was co-funded. So it was very important to us that the Wellcome Trust, who provided the initial funding, didn't fund all of it. We wanted some buy-in from the local area we were working in. So Wellcome 2/3 funded, and then the rest was on the local area to fund. And in the case of Oldham, they split it. The council went to the clinical commissioning group for half of the money. And actually, although we often see tight budgets as a kind of a barrier to engagement, sometimes by making organisations run projects together, they can really help with impact at the other side of it.
Wow, thanks, Sarah. So you're leading us on already into the next question about impact. So I'd be really keen to hear from all of you about what some of the impacts are on this project or have been. So when we talk about impact, so it can be on decisions, it can be on policy, but it could also be on mindsets, it could be cultures, it could be capacities. So for example, new expertise or prioritization of resources. So thinking about what has changed as a result of MH2K, and potentially as well, what shifts of power that you've seen as a result. Who would like to kick us off?
I think I should go first, just so that they can hop on after and add their professional outlook. But for me, oh gosh, I remember I was so happy when I first joined MHTK, and this is going to sound so cringe, and I don't want to make it sound like I'm selling it too much, but back then because I came from a background where we didn't talk about mental health, and I also came from a home where, how do I say, I was struggling with my own mental health issues, but I couldn't really speak to anyone about it, or I didn't know enough. But I also ended up being a young carer at some point during the time I was on MH2K, and during that time, because COVID also happened, I remember feeling very grateful that I had something outside of conventional education and my home life that made me feel like I was helping at least someone beyond what I was forced to do, and that was just one of the struggles I felt as a young carer anyway, that I felt obliged and I felt obligated to help someone, but being able to help people that were actually willing to listen to me and talk to people my age and know that there were people that cared about my opinion really helped me move forward. And I remember it helped me kind of, because I really admired the model. So no offense for copyright, but when I was at college, I started a mental health society because of what I learned on MHGK, and that society went on to win the NSBA Wellbeing Award back in 2021. So it was a really fun society. I remember I was so happy about it coming to fruition. But I did, unfortunately, because of all the kind of, how do I say, kind of all the weight I was carrying as a young person, I was very, very attributed to not speaking about my troubles. But the only people I ever shared my troubles with was the project assistant who built like that connection with me. Otherwise, I really disliked people older than, not saying people older than me are bad, but like people older than me who'd be like, well, I'm older than you and I know better. Like I was like, no, please I've had enough. I'm tired. But I unfortunately developed something called pancreatitis. So it came out out of blue, no cause. And I remember whilst I was in hospital, I used to sneak into meetings online, and they'd be like, "Why are you here? You're supposed to be resting." And I'm like, "But it helps me feel hopeful." And it really did. Like, despite all like the pain I was going through and the difficulties I was experiencing and the uncertainty of like health conditions and mental health conditions, it really, really, really gave me that sense of, well, I'm doing something, even if I'm basically emaciated, kind of. So I really had a fun time. But it did help me a lot as a person and grow. I always did say that if I didn't join MH2K, I don't really know where I would have ended up in life now, because this led me down the well-being route, and I've been on the well-being route for ages now. I do psychology now, like I'm doing a lot better. But if I didn't find MH2K, I'm not really sure where I would have ended up, weirdly. But I'm glad I did, because, oh. But yeah, that's my 2 cents. Any of the others you could take off from me before I waffle too much longer? Bella?
Thanks. This just so it's just really lovely to hear your experience. So thank you for sharing. So I think the question was about impact, and I did have a little think, and I wrote down a couple of things. And I mean, I think also just before I start, the point was made earlier that kind of we had an impact or evaluation report the year after MH2K in Oldham, and there have been subsequent evaluation reports, but we're still feeling the impacts, kind of nearly 10 years later. So, it really is, kind of want to get our heads around on that as a community, perhaps in understanding how we do that. So I kind of divided my impact into a few things. The first was about my learning. So I was on the local advisory group, but I feel that I learned a whole lot more than I gave, and kind of really that has stayed with me. The approach of Leaders Unlocked and Involve and MH2K, kind of was really kind of really fundamental to my kind of subsequent learning and practice. And as a result of that learning and practice, I've been able to take that forward. I'm still in the job that I was doing then, so kind of there is some continuity there that I've been able to, really apply some of the lessons to our work in, kind of the co-production of health research and involvement in health research. And that has been tremendously invaluable. So it's not influenced my own learning, but I would say, kind of our learning and practice as a sector in Greater Manchester doing this kind of participatory engagement work. You've already said it much more eloquently than I could, Bhavan, but kind of we still work with some of the young people that were involved in the original Oldham pilot. So another of your colleagues has just co-led a project with us that is around kind of, I suppose, bringing a real values-based lens and a co-production approach to the commercialization of innovation in the NHS, right? So, kind of that is just, it's just been brilliant, and it's just been so brilliant to, still have that contact and still work alongside each other. And then I was most involved in the Oldham pilot, and it's had real legacy there as well. So we continue to work in Oldham, and I think it's fair to say that MH2K really laid the foundations for some of those relationships, working with the voluntary and community sector, the ICB, kind of, and various other, kind of actors within that space. And we still kind of pursue that work through an initiative called the Ideas Fund, which is also focused around mental health and well-being, and is all about community-led research. So those are my impacts for the moment. There'll probably be more as they come to me, but over to you, Sarah, maybe.
Yeah, okay. So without duplicating, I went back through. So the project was independently evaluated, both the initial year in Oldham, and then the next year we rolled it out to 4 different areas. So then, and I only met like a few months ago because you took part in the area. So Leaders Unlocked and I ran the original pilot in Oldham together, and then the next year we ran 2 areas each, and then Leaders Unlocked have taken it on and run it since then. But the first 2 years were independently evaluated. So I read the Oldham evaluation again this morning, and I'm going to paraphrase it for you very quickly, and Carly's going to yell at me if I take too long or wave at me or something. So the independent evaluation for Oldham identified 5 key areas of impact. So the first was on decision making and initiatives around mental health and emotional well-being in terms of taking forward the recommendations. And I'll say more about that in a minute. The second one was on building momentum around tackling mental health in the area. So people from the council and people in the area who had cared about youth mental health and emotional well-being already reported that the project gave them momentum and leverage, was the phrase that they used, to really progress it, and that there was suddenly this interest from all these other service areas, for example, within the council, who hadn't been interested before. And the evaluation contained this huge list of events that the citizen researchers and the team went on to speak at, and all these requests for emails to find out what the young people said on different things that the council got afterwards. So momentum around mental health. It helped the council leverage funding for mental health work. So, for example, Oldham, by the time of the evaluation, Oldham Library had managed to get funding for arts-based projects around mental health and emotional well-being. It had impacted public participation practice locally. So off the back of the project, the council pledged never to produce resources for young people that weren't led by young people ever again. And also the local CAMs and the local Mind increased the involvement of young people in their work. And then also impacts on the young people who took part. I think Bhavan's said that much better than I could have. So yeah, the impact on decision making, building momentum for tackling mental health in the area, attracting funding for mental health work in the area, changing participation practice locally, and the impacts on the young people who took part. In terms of the impact on decision making, if I'm allowed time for it, so what the area did was they set up a task and finish group that sat under the youth, the children and young people's emotional wellbeing and mental health partnership board, which has always been a bit of a mouthful. But they set up a task and finish group. It had a lot of the members of the local advisory group on it. And the partnership as a whole was also chaired by someone from the local advisory group. And what they did is they went through the recommendations and mapped them against existing and planned initiatives, and also where there were gaps and what resources it would take in order to fill those gaps. So that led to a number of different impacts. So by the time the evaluation went back 1 year later, I should say they also set up the citizen researchers became a reference group for that task and finish group's work. So they contacted them by email. Sometimes they worked with them in person to inform what they were doing. So by the time the independent evaluator went back 1 year later, there had been changes in planned activity. So, for example, the CAMS was already planning to rewrite its guidance for professionals. Training was already planned for schools around how to create a positive environment, that sort of thing. And they had adapted those plans to reflect the recommendations of citizen researchers, and had also involved citizen researchers in checking those plans to make sure that they, that the content fulfilled what they meant in the recommendations that they wrote. So there's a whole list of kind of planned activities in the evaluation which got impacted. Then there were new activities. Just after, a little while on from MH2K, the Oldham became an opportunity area, a government opportunity area, which came with funding. And that resulted in them being able to implement a lot of the recommendations in the gaps, including lots of changes to schools, so developments of school mental health plans, training people in schools to run mental health and resilience programs with classes, running mini MH2K style processes within individual schools to, as they put it, drill into the recommendations, plus lots of kind of baselining, trialing and evaluating of initiatives. There's so much more in the report, but keep looking at Carly, who I think will kill me if I talk for too long.
It's also interesting though, Sarah, and it's great to hear from all of you. There's been so many impacts on this project, and you've highlighted a lot of those. But what I'm really keen to hear is, what were the key drivers or factors do you think that kind of led to this impact? Oh, who wants to go first?
Go on, Vin.
I'm Bhavan.
Okay. Thank you for the blessing. So, in regards to what I was thinking of, from a young person's perspective, I definitely believe the level of commitment to our voices. People actually sounded like they cared, and they weren't be like, "Okay, so what's your opinion?" And be like, "No," they were really engaged. And then the consistency in communication, like receiving text messages on a regular, being kept up to date wherever possible, and the reminders that what we weren't doing wasn't useless. But even the littlest praise, unfortunately, as a very attention deprived child, back then that meant a lot. So I was always trying to do my best, and just so I could hear Anna or Rose say, "Wow, you did a great job." Like, I did do a great job, but I loved that. That was my favorite part. And then being acknowledged through our names. So in the actual report, we'd have our names put down thanks to citizen researchers who helped. Da, da, da. And I was like, yay! I could show my parents this, so they don't have to be, very snarky about that anymore. And then hearing professionals say thank you, which is one of the biggest things. Hearing a professional actually stay behind and say, "It's really impactful to hear you guys share your opinions, and I wish we heard it more, but we're really grateful," had such a profound impact on us. It removed that sense of these people are way higher up than us in the chain, but it put us on an equal playing field that made us feel like we could actually interact with each other, and that people were willing to listen, but there just weren't enough opportunities for them to. So that was one of the biggest things, I think, for me, that showed that there was an impact, especially on the young people as well, who, they helped us all discover our own niche. And that's why I'm still in the welfare field even after so long. But that's purely because it helped direct me onto a path that I wanted to be on. And I'm really grateful for that. So that's from my perspective.
Fantastic. Thank you. Sarah, what were some of the key drivers or factors from your perspective?
I should say that Bevan's experience isn't unique. There are lots of other, it's a fantastic one, right? But I just want to make the case we haven't asked Bevan to do this because her experience is wildly different from everyone else's. There are lots of stories like this. So I reckon there are 5 main elements that for me help to achieve the impact on the decision makers, if you like, as opposed to what Bevan's been talking about. So I think the fact that the project was genuinely youth-led made a really big difference and was obviously genuinely youth-led. Everything was in the young people's words in terms of the findings and recommendations, but most importantly, they stood up at the big showcase and they presented the recommendations and their findings themselves and talked to decision makers about them themselves. And that created kind of, I just can't tell you the difference that made. And so the second one so it was genuinely youth-led. The second key thing, I think, was that the engagement was both deep and broad. So you had the group of citizen researchers, others are 20 to 30, depending on the area. But then they went out and engaged over 500 young people in their peer-to-peer sessions in every area that we worked in. And so I think that gives decision makers kind of confidence that the engagement has reached a kind of numerically high number of young people, whilst also allowing it to be youth-led and kind of qualitatively deep. Of high quality, which was me repeating myself. And thirdly, I think the context that the engagement took place in Oldham was important. That idea that they wanted a strategy on youth mental health and emotional well-being, but didn't know what to put in it, was a very helpful kind of place to run the project for the first time. That said, the impacts have been just as big in other areas where we run it in, where the contexts were different. But I think having a context where people are genuinely open to listening to what the young people had to say and kind of they have a problem that they're trying to solve, I think is really important. In the areas that we've worked in, I think a high-level buy-in has been important. In Oldham, it came from initially from Alan Higgins, as I was saying, the Director of Public Health. But he put together the local advisory group with some advice from us, and he sent the invites in his name or in other local advisory group members helped as well, depending on who we were inviting for that big showcase event. And in Oldham, that big showcase had 85 decision makers and researchers at it from 27 different organisations. And they were kind of talking to the young people, making pledges about how they could help implement the recommendations. So that was really powerful. And lastly, I think just the involvement of the local advisory group, some of the impacts of the work, kind of the fact that the local young minds changed lots about their resources, lots about their practices after the project is because they were directly involved. The fact that the commissioning group, I think, was so brought in was really helped by their ongoing involvement on the local advisory group. So genuinely youth-led, in-depth and broad at the same time. The context it started in, the high-level buy-in, and the role of the local advisory group. Bella, what have I missed?
No, I don't think I've got really much to add. I think just maybe some short reflections, and so speaking of Oldham specifically, the part, I think just actually the timing was really good and was really right, and I know that that's kind of not an easy thing to kind of measure or take advantage of or assess, but kind of it felt like kind of such kind of really good timing, and just and I think part of that timing was actually, or part of the impact of that good timing was also that the funding. So in Oldham, this came from Wellcome and from kind of Oldham itself, but Wellcome had the foresight to kind of let us run with this basically, and to really give kind of a really kind of great opportunity, the room to grow and to kind of really kind of thrive. And I think kind of that was really, I think that was really kind of good thinking at the time as well. And kind of it was also just helped to have kind of that buy-in in also future rollout to other areas. That's what I would add.
Beautiful, thank you all. I've got one very short but tricky question to end on before we open up to all of you to ask questions. So what would you say is the one, you have to choose one key learning for you, for each of you, when it comes to impact from the MH2K project? Bella, should we start with you this time, or is that too cruel to put you on the spot?
No, I think so I learned so much, as I said, from the experience. I think what surprises me is, not surprises me in a bad way, but I am still asked about MH2K to this day, even when I haven't kind of started a conversation about it. And kind of it is that kind of longevity of its impact, and I think that is really hard to capture and really hard to always kind of get our heads around. But kind of it has made me think that we just need to be paying much more attention to that, and thinking about how we kind of how we do understand that without it being too methodological, if you like. So just understanding that, and just the impact for me has kind of has been all about kind of that understanding of how you work with young people in a kind of meaningful, in an authentic, and in a youth-led way. And I take that forward to this day.
Thanks, Sarah?
I think the power of work that's led by the people who are taking part. And I know this was a youth-led project, and I think sometimes when projects are run with young people, people kind of pigeonhole it and think, oh, it could only be done with young people. But there are many examples of projects around the world that have used similar methodologies with adults. So the power of work that's genuinely led by the people it's seeking to involve.
Bhavin, what's your one point?
For me, definitely the fact that representation is so important, that you can't make decisions for people without their input, and creating a space where young people feel that they are acknowledged, because it does take a lot of courage to share your experiences to begin with. So being able to show credit where it's due, but also make sure that if you're making decisions for others, you ensure their voices in, regardless of what you do, even if it seems like a hassle, because it amplifies the validity of whatever you're doing by literally 1,000. So yeah, that's one of the things I'd say. And don't tokenize young people. Yeah.
So thank you so much for joining us, everyone. Thank you for our contributors. We will be announcing in the next few days our next Deliberation Unpacked, which will be around about the same sort of time next month. So if you've enjoyed it, please spread the word, let people know about it. We'd love to see you again, and also send us any feedback afterwards about what we could do to make this better experience for you in the audience too. But yeah, big thank you, and thanks to Phil and Adam for doing all the organising behind the scenes as well. Thank you, everyone. Have a lovely evening.